What is gross versus microscopic in breast cancer pathology reports? Imagine opening a report that explains what a doctor sees when they examine tissue from a breast biopsy or surgery. You might wonder what the different parts of that report mean. In breast cancer pathology reports, the terms gross and microscopic refer to different ways of looking at the tissue sample. The gross description is what the pathologist observes with their eyes when they first receive the tissue. They look at the size, shape, color, and texture of the tissue sample without a microscope. For example, if a small piece of tissue is taken from a biopsy, the gross description might note its size in centimeters, its color, and where it was taken from in the breast. When larger tissue specimens are removed during surgery, like after a lumpectomy or mastectomy, the gross description can include more details. It might describe the overall dimensions of the tissue, any visible masses or lumps, how close the tumor is to the edges of the tissue, and if any markers or ink were used to help identify specific areas. However, it's important to remember that the gross description doesn't tell us much about the cancer itself. It provides a broad overview of the tissue but doesn't give details about how aggressive the cancer might be or how far it has spread. That's where the microscopic description comes in. The microscopic part of the report involves examining very thin slices of the tissue under a microscope. This detailed look allows the pathologist to identify cancer cells and understand their characteristics. Under the microscope, they measure the size of the tumor in millimeters or centimeters, determine whether the cancer started in the milk ducts or lobules, and see if the cancer has invaded surrounding tissues or remains confined. They also assess the tumor grade, which indicates how abnormal the cancer cells look. Well-differentiated, or low-grade, cells resemble normal cells and tend to grow slowly, while poorly differentiated, or high-grade, cells look very abnormal and often grow faster. The microscopic exam can also reveal other important features, such as areas of dead tissue called necrosis, how many cells are dividing, and whether the cancer has spread to nearby lymph nodes. To sum up, the gross description gives a general picture of the tissue sample's physical appearance, while the microscopic description provides the detailed information about the cancer cells themselves. Both parts are essential in understanding the diagnosis, staging, and planning treatment for breast cancer. Remember, always discuss your pathology report with your healthcare team, as they can interpret these details in the context of your overall health and treatment options.